Next, we have preterm newborns. So, preterm newborns are refers to the babies born before 37 weeks of pregnancy. So, normal pregnancy is typically last 40 weeks. So, between 37 to 42 weeks, we consider the baby who are born between these weeks as full term, right? So, if there is a baby who is born before 37 weeks of pregnancy, we consider them preterm baby. And preterm babies are further categorized into four different parts. So, first one is late, like they are close to the term but before 37 weeks, so that is 34 to 36 weeks. Moderate is like between 34 to 32 weeks, and very preterm is 28 to 32, and extremely preterm are like 20 before 28 weeks. So what happens with extremely preterm babies, because they born 28 weeks before, their lungs are not that mature and they are at risk of compromising airway breathing because their lungs are not mature. So we have to give them medications like betamethasone to the mother and omethasone in the baby to like the surfactant replacement therapy to help mature the lungs, right? So next is causes of preterm birth. That first one is multiple pregnancy, like twins or triplets, infection during the pregnancy to the mother, problems with placenta like abruptio placenta, placenta previa, placental insufficiency, stress in during pregnancy, lifestyle factors, smoking, alcohol intake, substance intake, right? Eclampsia, preeclampsia, diabetes, those all condition leads to this. Then how does this baby look like? Their skin is very fragile. They have irregular breathing period with apnea. So they will be breathing, but their breathing is irregular, like going up and down, and there will be a pause in between the breathing. Then they stop breathing, start breathing again, but it is irregular. Poor sucking and swallowing reflex because they don't have that strength yet, and their extremities are thin and minimal creasing on the palms and soles, and extended extremities and always, and they don't know like how to flex like on their limbs towards the body, right? They're always in extended extremities position, and you will see like a large amount of hair on their body, especially on the back, that we call woolly patches, thin skin and minimal subcutaneous fat. So very skinny baby. Then what are the challenges with these babies? So first, because their airway is not that developed, so breathing difficulties, feeding problems because of the poor reflexes, and the temperature control because they don't have that subcutaneous fat and their skin is very thin, and infection risk because their immune system is not mature yet, right? So how you can help these babies? By helping with breathing either by ventilator or other devices, feeding tubes by or by special formula feeds, and keep them warm by incubator or special warmers, and use hand hygiene and extra careful precautions to prevent any type of infection. And if they get it, then you have to treat the infection, right? So what are the complications for these babies? Like they can develop temperature problems, hypothermia, intraventricular hemorrhage, and necrotizing enterocolitis. That is a condition of small bowel where they have like a necro, it gets necrotic, right? Then a very important point for this oxygen point, that for all the newborn not newborn babies, we don't give them excessive amount of oxygen. We give them oxygen but less concentrated and least amount of oxygen to maintain their saturation between 90 to 92 in case they need external support, because the excessive amount of oxygen cause damage to their retinopathy, and they sometimes go blind permanently. So you have to be very careful on this question. It comes in NCLEX. Next, we have large for gestational age babies. So these babies are born, but their weight is like more than the normal for their age, like gestational age, right? So typically they are like 4,000 gram more, or 8 pounds, something like that. So typical cause of this is mothers with diabetic, their babies are born big, and sometimes genetic factors, and mother excessive weight gain of mother during pregnancy, and if there is a previous baby with the same weight, and post-term pregnancy sometimes can lead to this. So these babies are big, so their delivery during the normal vaginal procedure is sometimes gets complicated, and they develop injuries like shoulder dystocia, clavicle fracture, and brachial plexus injury. So you have to assess them for these injuries. Hypoglycemia because of the high insulin levels afterward, and it will be presented by jitterness for feeding, temperature instability, lethargy. Respiratory distress will be occur because sometime with the baby is born with the cesarean section and has like a tachypnea of the newborn, right? Jaundice occur due to the high level of bilirubin in their body. Sometimes polycythemia occurs due to the increased level of RBC in their body, because then their blood is so concentrated that it doesn't flow inside the veins very concentrated. Congenital abnormalities can develop due to the problems, right? Then nursing intervention for these babies, you have to monitor them for the blood sugar because they are at risk of developing hypoglycemia. Frequent feeding to prevent the hypoglycemia. Observe for breath injuries, then monitor for jaundice. How are you gonna check jaundice? Check their eyes, like color of the face and those stuff. Respiratory support by like ventilator or oxygen support, right? So this is a like mnemonic you can remember: big babies from blood sugar, injury assessment, growth charting to see if they are gaining more weight or they are losing weight, babies breathing check, and feeding methods, then birth history, inform parents. Like these are how you can help, right? Evaluate for jaundice and support system. So we have a question here. A baby is delivered at 39 weeks with this weight and initial assessment. What is the priority? So for these babies, the priority will be assessing their blood sugar because they are at risk of hypoglycemia. So we don't want that, right? Respiratory distress syndrome is another condition that occurs because of the lack of lung surfactant in the lungs, leading to difficulty in breathing and inadequate oxygen. So, what is surfactant? It is a substance that is present within the lungs to keep the alveoli open. Usually, it's developed by its own between 24 to 28 weeks, but fully developed by 35 weeks. So, as I told, babies who are born between 24 to 20 before 28 weeks, that they are at risk of poor lung maturity, right? And risk factors include a premature birth, maternal diabetes, cesarean section, delivery without labor, multiple births, history of previous respiratory distress syndrome. So, how these baby present? They have rapid breathing but shallow. They have tachypnea and they breathe fast. They grunting sounds and with breathing and flaring of the nose. Retractions occur. You will see that retraction pulling of the chest inward, and cyanosis, bluish coloration of the skin, mucous membrane due to lack of oxygen, right? And on x-ray you will see glass ground appearance on the x-ray, and when you do the abg you will see low oxygen, high level of carbon dioxide. So how are you going to treat these babies? By giving them a replacement therapy, breathing tube. Through breathing tube you will replace the surfactant, right? Oxygen therapy to maintain their saturation. CPAP is given to keep their alveoli open, mechanical ventilation in case of severe condition, and sportive management, right? Prevention, how you're going to prevent. So antenatal steroids, like before preterm delivery we give betamethasone to the mother so we can mature the lungs. Next, we have necrotizing enterocolitis. This is a condition of small intestine, so that is related to GI, leads to inflammation and bacterial invasion of the small bowel walls and leads to necrosis of the tissues. Risk factors include premature, which is most common. Low birth babies. Premature is because their immune system is very weak. They are not able to fight the infections, and because of that, it leads to these conditions, right? Low birth babies, formula feeding, birth asphyxia, lack of oxygen at birth. Formula feeding is because sometimes these feedings are contaminated with bacteria from outside, right? So the sepsis and infection. Symptoms will include abdominal distension. You will see their belly is swollen. Feeding, they will do like frequent feedings. You will do feeding, but they will vomit frequently after the feedings, and they won't tolerate the feeding. Blood in stool, lethargy, apnea, pause in breathing, and signs of infection, sepsis, so fever, abnormal heart rate, respiratory distress. So abdominal X-ray will be done after seeing these symptoms. Then you will see air in the cavity, and because the dead tissues are producing that gas, and the lab test will show WBC increase, right? So first of all, what you will do for these babies, NPO, and no feeding by mouth, IV fluids, antibiotics to treat the infection, anti-tube insertion to decompress the stomach to remove that air. Surgery will be done to remove the necrotic tissues out of the body. Next, we have hyperbilirubemia. This is a condition characterized by the presence of high bilirubin in the blood, leading to jaundice, that is yellowing of the skin and eyes. So bilirubin is, what is bilirubin? It's a pigmentation that is present, and it produced by breakdown of RBC, and it is processed by the liver and excreted in the form of the bile. So we have main two types of jaundice: pathological and physiological. So physiological, that occurs after 24 hours of the birth, and this will resolve by its own. And next we have pathological. This is occurs before 24 weeks of 24 hours of the birth, sorry. And this is common occur due to any like a problem, so like hemolytic disease, breakdown of RBCs in the body due to any problem, and liver dysfunction. Next, we have risk factors for these, and we have also breastfeeding jaundice that occurs after first week of the breastfeeding, inadequate feeding. Breast milk jaundice that occur in the first week due to presence of bilirubin levels. Milk, there is a substance in the milk that increases the bilirubin level. So risk factors are pretty much same: premature birth. So when we have condition blood type incompatibility, if the mother and the baby's blood doesn't match and they got mixed during delivery, and it leads to lysis of the RBC and increase production of the bilirubin. And next symptoms will be yellowing of the skin and sclera, the white white of the eye, lethargy, perforating, high pitched cry, and dark urine and pale stool. Visual assessment will be done under natural light. You will see yellowing of the skin. Then you will do tests. Blood test will show the high bilirubin level, and then through the skin you can do this transcutaneous bilirubin check. And Combs test are done to check the antibodies present that may cause hemolysis. So what we do in this case, phototherapy. So phototherapy is very important treatment to manage like hyperbilirubin, but you have to be careful when you give phototherapy, because during phototherapy there are some ones you need to consider. Like baby should be in phototherapy, the lights are very damaging to the eyes and the to the reproductive area of the body of the fetus, oh sorry, of the baby. So in that case you have to cover the eyes of the babies and put a diaper on the baby and put them in the phototherapy thing machine. But eyes should be covered up with the patch, right? And the genitalia should be covered, and the skin irritation, because it causes skin irritation and breakdown. But you have to, when you do the phototherapy, it's for a couple hours, but you can do the feeding, mother can do the feeding in between. So whenever you do the feeding, you check their eyes for damage, and you check their reproductive organs for damage. And skin temperature monitoring closely, make sure it's not too hot and causing burn to them, right? And loose stools can happen, that is normal. And then whenever you have to check the skin color, you have to turn off the light of the fluorescent light of the phototherapy machine, so you can see the actual color of the baby. And sometime baby get a bronze baby syndrome, that is grayish brown discoloration of the skin, which is a complication of phototherapy. And in the phototherapy machine, we have to turn the baby every 2 hours and feed them every 2 hours or more often. And it's not like baby will stay overnight. Baby can get the treatment and go home and come back like that. And the phototherapy machine should be turned off during taking any specimen for the blood or serum bilirubin, right? Any blood samples you're taking, you have to turn off the machine. Next, we have a erythroblastosis fetalis. So this is a condition that is very serious and life-threatening, where the immune system of the Rh negative mother produces antibodies against the Rh positive RBCs of her fetus, leading to hemolysis of red blood cell of the fetus. So Rh incompatibility is the cause. In this, what happens? It occurs when a Rh negative mother carries a Rh positive fetus. During pregnancy or delivery, the fetal RBC can enter the mother's stream and promoting her immune system to produce Rh antibodies. So, if a mother is Rh negative, baby is Rh positive, and during delivery their blood got mixed, the mother body will produce antibodies against the fetus, like blood, right? So, in next pregnancy, if the baby is again positive, then these antibodies will interact with the next baby and leads to lysis of the RBC for them, right? So, pathophysiology is mainly that antibodies cross the placenta and attack the RBC fetus, leads to lysis, which leads to anemia in the fetus and heart failure, severe edema, and sometimes cause death. So you will see the newborn will be yellowing of the skin, anemia, enlarged liver, spleen, edema, swelling due to fluid accumulation, difficult breathing, and maybe have a full body edema, right? So prenatal screening, we will do blood test to find out the status of the mother and fetus. Are they Rh negative or positive, and take precautions. Amniocentesis will be done to measure the bilirubin level. Ultrasound to check the fetal anemia. Coombs test directly done on baby, or indirect Coombs test is done on the mother to detect the antibodies present. Treatment is done in intrauterine when if it is developing, like for example you see that maybe mother's and fetus blood is already mixed and the baby is still in the uterus, then you have to do intrauterine infusion to treat fetal anemia. Afterwards we will do phototherapy to treat the jaundice for the baby, and exchange transfusion to remove antibodies from the fetus blood and damaged RBC, and immunoglobulins to reduce hemolysis, and supportive care for anemia. Prevention can be done to administer ROGAM injection during pregnancy or after delivery of Rh positive baby to prevent antibody formation. So ROGAM injection should be given within 72 hours of the delivery. Next, we have fetal alcohol syndrome. This is a condition that occurs due to um, alcohol intake during pregnancy by the mother, right? So these babies develop if a pregnant woman drinks alcohol, it can affect the baby. So what how you will see the baby will be: physical defects, small head size, facial features, small ridge nose, right, short height, low body weight, poor coordination, poor vision, poor memory, learning disabilities, poor judgment skills, hyperactive babies, difficulty in school, trouble getting along. So these are all the effects that happens on the baby because the mother is drinking the alcohol. So only problem you can solve this question is like avoid taking alcohol by the mother, right? So how you will see, you will observe these babies for physical signs, physical abnormalities, central nervous system abnormalities like for coordination and developmental delays. A nutritional support you have to provide because their baby have physical defects and they are not able to drink and eat as much as they can, and developmental delays will be there, so early intervention for that and safe environment because of their behavior problem. Sport and counseling services will be provided to these babies because they are socially different than other because they have problems, and then you will see how you can provide counseling to these babies. Thank you.